So I got breast implants put in when I was 20 years old, obviously very young. I did a lot of my research about whether or not I wanted to do this on YouTube and on Google. I had severe nerve pain from having the implants in. I had them removed April of 2023 this year. And the doctor who removed them, when I went to the consultation, educated me significantly on what happens to your body when you get implants put in. After that consult, I was like, the world needs to know this information, because what happened to me from having my implants put in, the complications that I have had are extremely common. Not like a freak thing that happened. I want to make sure that this information is on YouTube, because I know that a lot of people are going to get their information on YouTube. My opinion really isn't in here. My takeaways really aren't in here. I'm going to be doing a whole separate video on my reaction to the information that is shared in this video, because it's unbelievable how complicated this is. It just blows my mind. Your mind will be blown from this video. I wish this video existed when I was researching before I had my surgery. If you have implants already, it's not a lifetime device. She will talk about things that I think will help you pick somebody to have them redone or have them taken out. I'm so grateful that she sat down with me to film this. I hope that it helps you guys. I love you, and I'll talk to you soon.
Okay, are we ready?
We're ready. We're rolling.
Okay, so where should we start?
I don't know.
I should introduce you. Do you want to say a little bit about yourself?
Sure.
Okay.
Hi, I'm Sophie Bartsich. I'm a board-certified plastic surgeon. I practice mostly in New York City, but also in Connecticut. I did my training at Cornell, and I'm still affiliated with New York Presbyterian Hospital, but I'm in private practice. And my practice focuses mostly on cosmetic breast surgery and also abdominal wall reconstruction. But a very big part of my practice is cosmetic breast surgery, everything from augmentations to lifts to reductions. And I pride myself on giving my patients a lot of good information and helping guide them through what is actually a pretty difficult decision and very loaded. We're hoping that we can bring some of that knowledge to you guys and give you a little bit of guidance as well.
Yeah. See, I'm glad you did it, because you said it better than I would.
There we go.
Yeah, basically we just want to provide you guys with information that I wish I would have had before surgery, and that we think is helpful for people to know before making a decision that's literally going to affect you for the rest of your life. The thing that was taken out of me, how big was it?
I don't know, kind of like a grape, you know? It just felt firm and scarry, and I was, so I was like, okay, well, this is where it hurts, and it kind of feels different than the rest.
Wow,
so
I didn't know
take
it was
it out.
that big.
Yeah.
Immediately, when you wake up from surgery, I couldn't feel the whole, bottom part of my left breast.
With your first surgery.
Yeah. And the nipple was super painful and sensitive, and it never came back.
The nerves to the breast and the nipple come from the side. They come wrapping around the side, and there's a whole network of them. So this is not a situation where there's one major nerve and you just better stay out of its way. When you have a whole network and you have no choice but to make a space where you make it, sometimes the body tolerates it fine, and sometimes that one little branch in that area just gets mad. So my best guess is that something in one of those little branches, which nobody would have been able to see anyway, was irritated. It caused numbness at the end of it, and on its way to the area that was numb, I think it just made a scar. And anything around nerve can be incredibly uncomfortable and just can sit there and be miserable forever. And you can't even touch it. So my best guess is it was something like that. That's why I said, if a painful scar, just take it out.
I remember going to get a breast exam, and she said half the girls that I see who have implants have some type of pain. And I was
Really?
that is crazy. And it was weird because I think you said that the right one had a capsule, much harder than the left.
Every foreign body that you put in the body is going to make a capsule. If it's a splinter in your finger or a knee in your knee joint, wherever
people don't know that either.
People
they think
don't
it
know
only
that.
happens when something goes
They
wrong.
think a capsule is when you have the problem with the capsule.
Right.
But there's always a capsule.
And that one was irritating to me, but that weird hard spot was on the left, not the right. And the right one was worse. What was the level of capsular contracture in the right one?
I
It
believe
wasn't that bad, right? Or
I think it was a 3
out of 4?
Yeah. So once you can feel it and you can even see it a little bit, you're at 3. Once you can really see it, you're at 4.
I feel like
It was
I just
tight.
got so used to being uncomfortable.
Yeah.
That one weird spot where you took that clump out, like that was what I was focusing on because
Right.
it was like you couldn't ignore
That was
it.
a bigger problem.
Yeah, but like it's crazy that you just get used to like being uncomfortable.
So that's
know?
a very good point. We can acclimate to unbelievable things.
Yeah.
Like unbelievable, and just sort of learn to live with them.
Right. We were talking about like what is the process of having the implant taken out and why does it need to happen that way? And that's when I started realizing, wow, this is crazy. Because you're like, oh yeah, the capsule could be on your ribs and I don't want to puncture. And I was like, and then it's like, you know, you recommended the lift and I was like, I don't want to lift.
When we talk about lift, to me, unfortunately, the majority of lifts are usually performed like a small reduction.
Okay.
It's very unusual for someone to get offered a lift that's not going to make them smaller than they are. So usually they get offered an implant at the same time. Or they have to agree to being smaller than they are.
Why don't they just lift them?
Because
I say just, I don't even know what I'm talking about.
I don't think it's something that most surgeons really know how to do. So if you go from there to now we're taking an implant out. When you take the implant out, depending on the situation, you're basically starting from often more severe but still the same kind of thing where you're just deflated, stretched out, and there's no shape there. So going from how do you do a shaping without compromising any volume, when you take an implant out, you really don't want to compromise volume.
Right.
You know, at minimum, you're going back to where you were before you got the implant, and sometimes you're going to even smaller than before because you've had so many changes that can happen from having the implant in. So you really need it kind of just completely reshaped and reorganized, or it's not going to look like a really beautiful breast. It just can't.
Right.
So there's a lot of reshaping without removing that has to be done, and it becomes like sculpture.
Right.
It really does. And you have to have an incredibly good three-dimensional sense, and you have to be able to make that happen without losing blood supply and while still, you know, keeping the nipple intact and all this.
Unbelievably
But
complicated.
it is, and it's underestimated.
Right. I was just gonna say, like, when I was looking for doctors, I was like, well, how complicated could it be? Like, you're literally just removing something, and it's like, I didn't know that until after talking with you and realizing how complicated it is.
Yeah. Usually they're given either, all right, listen, we're going to take the implant out, but I got to warn you, it's going to look terrible. You're going to feel flat-chested. You're going to think it's very attractive. Can I talk you into a different implant or a smaller implant or some kind of implant? If they do a lift, usually you're going to sacrifice even more volume, right? Which is not what you want to do. And so you're kind of picking between two things that don't sound great.
Right.
And then in some cases, if they're like, all right, well, just take it out. You're going to be left with what you're going to be left with. If you really just take the implant out without the capsule, things can't even stick down and heal back together.
What is the stuff that sticks together?
So the tissue.
Not like the top skin, right? Just
No,
like
the stuff
tissue.
inside. Like
Okay.
basically the layer, the muscle sticking back down to the ribs. Things like that.
Okay.
You know, or the breast tissue is sticking back down.
Depending on the capsule, if it's like thick,
Right.
you're going to leave this empty space in there. And the
Right.
whole thing is just going to, and if anything, that capsule can actually keep things all stretched out. Like it can maintain some shape because it's such a thick element of its own.
That's when we really started talking about all the things that having implants put in can do to your body. You just think that it's a normal thing because everyone has them done.
So let's talk about some of the things that can happen from having an implant in.
Yeah.
First, let's say implants are great. We're so happy we have them. Everything has its possible issues. I do have a group of patients who sort of say, you know, I did this when I was really young, in my case, and you know, the doctor spent very little time with me. I didn't ask any questions. I have some patients like, you know, I can't even remember the name of the surgeon who did it. I can't believe I'm saying that. You're going to be naked and unconscious in a room full of strangers who are making decisions you're going to have to live with forever.
Right.
It's a very big deal, and it should never be treated casually.
Yeah.
So what are the things that can happen? The majority of surgeons put implants under the muscle.
That's
So
what mine
the
were,
layers, that's almost everybody. So the way the layers work, you know, it's the skin, the breast, and then the pectoralis muscle, your pec muscle, and then the ribs. And the breast actually lives between the skin and the pec muscle. but most people put the implants under the muscle because they think it gives it better coverage. And the issues are many. If you have this big implant and stretching everything out, yes, you probably do need the muscle to contain it. One is it'll cover it, and two is it'll kind of hold it in place. But if you have a really well-fitted implant,
A natural
that can
size,
just
yeah.
sit comfortably in the breast,
Then you don't need to go
I don't
under.
think in most cases, I don't think you need to go involving the muscle in it.
Right.
Just to contain it. You don't need to contain it. The pec muscle is pretty strong, and it's normally stuck down to the rib cage. So to make space underneath it, you have to sort of pull it off the ribs and do a lot of damage to it. And that's why it's so uncomfortable when you're recovering.
Oh my, that was the worst.
Yeah.
The worst pain I've ever felt in my life.
Yeah, because
I thought if I stand up, it's gonna rip open.
and
That's how it
because
felt.
well, technically the muscle does have to get ripped, and all these things have to happen, and then it's pushing against the ribs as well.
Right.
Now, when you have the implant under the muscle, your capsule is going to be on the superficial part. It's going to be between implant and muscle, but underneath it's going to be right against the ribs, and it's stuck to the ribs because it forms right against them.
Right.
So if you ever have a problem with the implant or the capsule in particular, it's very hard to get that off.
Yeah.
So probably the reason a lot of the surgeons you spoke with said I only take the front part
It's because they don't want
is
to touch
because
on the
they
ribs.
don't want to touch the part on the ribs.
Right.
And sometimes you don't have to if it's really thin, but you don't know till you get in there. Sometimes it's literally like leather, and you don't want to leave that behind, right? There are even very rare cancers that can develop in that scar tissue.
Oh, wow.
And being able to get the capsule out could literally
Save your life.
save you in very,
Right.
very rare circumstances.
Right.
So for me, I'm always like, oh, I wish, the capsule wasn't on the ribs because it is challenging. I take them out a lot. I'm comfortable with it. But it is risky. It's risky to get into the chest wall. And, you always want to get the whole thing out because what if this is going to be that one person who has a problem? You didn't really clean things up.
Right.
And then the other thing is the pec muscle's strong. It's still contracting. It's pushing on the implant.
Oh my gosh, yeah.
The implant's trying to make room for itself, right? So it's pushing out on the muscle, it's pushing out on the breast, but it's also pushing into the ribs.
Yep.
And what ends up happening, and the bigger the implant, the more this happens, it can actually, in some situations, cause the ribs to flatten and sometimes even scoop in.
It created a pocket.
Yeah.
Like I can literally feel my rib is both sides. My ribs stick out dramatically, and I can put my thumb in a hole.
Because it scoops in.
It's
Yeah.
so weird.
The ribs are bone and they become cartilage. And it's very malleable. It'll kind of impact itself and
Right.
become like a bowl.
Yeah.
And someone goes to take it out, you're not starting from your normal chest wall, which
Right.
is curved like this.
Right.
You could be starting with a little concavity, like a
Yeah.
bowl on your chest. And that's going to change your options for looking even back to baseline.
Right.
You know what I mean?
Is that something that's rare? The ribs moving?
No.
Because I didn't have massive implants, and
Right.
I also didn't have them for that long.
Well, it doesn't take that long for that to happen, right? Because the
Wow.
deformity is going to happen early on when things are tightest. And it's
Oh my
trying to figure out where to
gosh.
push, right?
Wow.
So the implant will push into the ribs, it will push to the muscle. The muscle itself, in some cases, can get thinned a lot from that too. And it will also put pressure on the breast tissue and skin. So the skin will stretch out, right? And the breast tissue, with continuous pressure, the breast tissue can atrophy. So,
What's that mean?
meaning it can shrink.
Oh, okay.
So you can end up
Wow.
where your skin is stretched and the breast tissue is thinner than it was before, and
now your
the
ribs
chest
are
wall
all-
has a scoop. So and everyone's different, right? Some patients, they don't have a very serious side effect. Some patients who take the implant out and it's almost like nothing happened.
Right.
That's not that many people, but it can. In most people's minds, you put it in and then you can just take it out.
Yeah.
And that's not
exactly.
how it is.
Right. I have tattoos under each breast, and I remember looking at a photo, and I'm like, okay, my boob is 2-3 inches above my tattoo, and now looking at how I look after the implants, and you can barely see my tattoo.
So what ends up happening is a lot of surgeons will actually drop the fold, meaning it's attached somewhere. They'll open that attachment so that the fold becomes lower.
Okay, so this isn't me, but the before on the left, you can see that the fold, the crease of her underboob, is higher than her tattoo. It's not touching it. But then on the right, the under boob, like that crease, the fold is touching the tattoo. So sometimes it is lowered naturally because the implant just needs to make space for itself. But what Dr. Bartsich is saying is that a lot of doctors, once they make that incision and get inside, they'll cut down so that your crease is lowered with them cutting it.
I personally don't love doing that. Most of the time I find you don't need to. So there's a couple things. One is nature's fold is better than any fold anyone can make.
Right.
Doesn't matter who the surgeon is. These natural attachment points, like the spot between the breast and the middle, you never want that releasing because it's almost impossible to get it back down the way that it was before. These natural attachment points are really secure and they're there on purpose. And you're going to get some natural stretch from the implant. You usually don't need to really blow through the fold completely.
Right.
And then when you blow through it, most people don't reinforce that. So now you don't have it being held by this really strong natural support.
Right.
The implant
Damaged it.
can just start to slide down.
Yeah.
We say laterally for out to the side. Laterally, there aren't as many attachment points and things are really easy to open.
Okay.
Like laterally, you could just use your finger and things just open. So if you open the pocket even to the point where you want the implant to go, it's
gonna
too
go
much
past that.
because it's going to go past.
Right.
So this is just, you have to figure this out by doing a lot of it.
Right.
And then you realize you actually want to go really not even close to the side.
Right.
Because if you go the full way,
it's gonna,
right, if you go the full way, while the implant's fighting in every other
It's
direction,
gonna go.
the easiest place to go is
to the
there.
side. Yeah. Right.
So it's going to go, oh, there's room here, I'll just take a little bit.
right.
And then before you know it, you're here, it's fine, you lie down, it's here.
Yeah, and right before I went into
Yeah.
surgery, oh my gosh, I was laying in the hospital bed
Yeah.
on my back because you said show me that spot, like let's
Yeah.
mark that painful spot before we go in, and I was laying on my back trying to feel around, and the right implant was literally was it touching the bed?
Almost.
It was very close from touching. I mean, it was wild. My whole
Yeah.
boob was on.
Yeah.
Was here,
'Cause
and
the
this one
pocket
was
was-
straight up.
Yeah.
And it's it seems like two people did it. And you're well, I didn't know that either.
Yeah.
That sometimes an assistant that you've never seen, never met, can do one implant while the doctor's doing the other one.
That in breast surgery, that's not very uncommon.
That's wild.
Especially with reductions, which are very labor intensive. It's very, very common. It's more common that two different people are doing the case. than
Right.
one.
And who knows what happened in my situation, but my scars are different heights. When I have them put in, they're different they're different on the side, they're different this way.
It's very easy to put an implant in. It's very hard to perform a great breast augmentation and get a great result.
Mm-hmm.
Those are two different things.
Right.
You know what I mean? But the fold thing is real though, because once you've lost your natural fold, whether it opened on its own, which it usually doesn't, or someone opened it, when you take the implant out and you're scaling back down to a small breast, you have to go back to the short distance.
Right.
Right? You have to.
You have to
Because-
re-stick this
Right,
skin
because
to
otherwise
itself. Yeah.
you now have a fold that's way down
Right.
for a breast that should be up.
Yeah, so my boob would have ended here.
Correct.
So instead of having the volume it has, it would have been kind of flat
That's
and
right.
long ending
That's
here.
right.
So we sewed the skin
Correct.
back to where it naturally should stick. You know?
Reset the fold.
Yeah, reset the fold, which is so cool. And then
Yeah.
you don't have any additional scarring on the outside because
No, you do that internally.
you do it inside, which is so cool.
The problem then becomes that if the incision you had has also migrated or was made low because they were releasing the fold to a much lower level, once you reset it, then the incision will no longer be in the fold.
Right,
It'll
yeah,
now be
I can see
further
my
down.
scars,
Yeah,
right.
it's further down. So that's better
Yeah.
than having the fold in the wrong place.
Right, I agree. And
Because,
we just went to the beach for a week. Every single bikini I have, you can't see the scars. Even
Yeah,
when you're
it'll still
in a bikini.
cover it because the band will
Yeah,
still be there.
right. I was even scared to do that at first because I wasn't understanding it, and I just heard more stitches, and I was
Right.
oh my gosh, I'm scared. I don't want to do that
Mhm.
because obviously having surgery in the first place is what made me have that
Right.
pain. So I was scared of anything that.
And it's
You
not,
know?
it's also not that easy to understand.
Yeah.
If you've never done it or seen it,
Yeah.
it's very hard
Yeah, I wasn't
conceive
getting
of.
it. Yeah.
You know, where I'm like, no, I'm going to put the fold back up, but there's
I'm
no
like, wait,
other
what?
scars, and you're like, I don't understand.
Yeah. What is the process? Like if someone gets it above the muscle, it's easier to remove that capsule?
Much easier because you're taking it off a muscle
Okay.
on the bottom side. So it's much easier.
So is it just adhering to like your skin, the top side of
The
it?
top side's adhering to the breast tissue.
Okay, so is that removed?
That's removed too, yes.
Okay.
The issue there is if you don't really know how to take just the capsule, you're going to take chunks of breast tissue with
You're
you.
gonna have chunks missing.
That's right.
Right.
And you don't want to lose any more volume.
Right.
Plus, in most of these patients, they don't have a lot of breast tissue to begin with. The breast augmentation patients is usually a small amount. And if you take not even big chunks, if you take little chunks, you're going to get irregularities.
Right.
Because you're going to have holes. It's not like there's this huge layer and taking small bits won't matter.
Yeah.
So you have to be, that's more of like how's it going to look as opposed to a danger. But you want to make sure that they're not just kind of taking, a lot of the breast tissue with the capsule.
Right.
I personally, this is my personal opinion, I personally think a lot of women get implants that are too big for them. I just think that's
That
the
was
case.
another thing. Every single girl I watched on YouTube was like, if you want to go in this size, just do it a little bit bigger, because like you'll regret it if it's not a little bit bigger. Now everyone's walking around with implants.
They're very,
Took
very big.
that advice.
They're very big. Not only the patients who say that, but the surgeons amongst themselves are like, listen, the last thing you want is you do a good operation, the patient goes, I wish I went bigger. So just
Right.
always put in a really big size so no one says, I wish I went bigger. And I think there may have been a time when that was true, and women were like, I should have just gone for more. I don't think that's the case anymore. I spend all day talking to women who are like, I've had these done twice. I don't understand why I can't go smaller. And I'm like, you can totally go smaller. So when you do a procedure at the hospital, the receiving area gets all the implants. And so they have like a cart where they have the implants for your case, right? And then the cart's right outside the room. And it's really funny because I usually know what size I'm using. So I'll order that size and maybe one other one just to have it. But most plastic surgeons will order like 10 different sizes.
Oh, because
and they don't know what they're going to use.
Yeah, right.
And there's a cart is like piled up to here outside the room, and they're putting in a sizer and taking it out. The sizers are not permanent implants; they're made differently so that they're made less expensive,
surgery?
and you can put it in during surgery and test out the size.
Oh wow.
So there's a lot of tissue manipulation and going in and going out and going in and going
do they
out.
do that every time you have surgery?
Depends on the surgeon,
Wow.
and some of them do, and they could be in there switching out a lot.
Do you think it's good to do that?
So I personally don't think it's good to do that for a couple of reasons. One is it's a lot of trauma to the tissue, right? Because you're making no matter who you are, you're trying to make a small hole. You don't want to make a large scar. So you're pushing something in and pulling it out and pushing something in. So it's a lot of trauma to the tissue. It also takes a lot longer. So you're in the OR longer, right? But the other thing is, talking about capsular contracture, we believe it has something to do with the bacteria that is in the breast. We have found that doing things to decrease the bacteria will help. But the other thing is, things are sterile, but it's a relative term, right? Nothing's ever completely sterile, right? And the breast has bacteria. So the more you manipulate the implant, the more you're contaminating it.
Right.
You're putting one in, you're taking it out, you're putting it on the table, then you take a different one, then you take the first one back, So I think that, in my opinion, that is going to just potentially increase risk of contamination, complications. I feel like you should have a sense of what you're using in most cases.
You should kind of know.
You get or you don't get what the person wants, right? And you shouldn't do anything till you understand.
Yeah.
If I can accomplish anything I put my mind to, if I don't have the same idea in my head that the patient has, I'm not going to do what they wanted, even though I did exactly what I planned.
Right.
So that's super important.
Yeah.
And once I know what the patient wants, then it's my responsibility to draw from my experience and what I know about the implants, what I know about the patient.
Right.
And then I can say, I bet that the 275 is going to give her exactly what she's asking.
Right. A lot of women want to have the control over the implant size they're choosing because they don't really have a relationship with the doctor. It's like, why would I let them decide? I talked to him for 5 minutes. And usually it's a man.
Yes.
And it's like, you feel uncomfortable and you're like, oh, he's going to see my boobs. The silicone versus saline.
There are a lot of patients who are nervous about the idea of silicone, and they think of it as less safe and more problematic. The shell is the same.
So even people who have, obviously, like saline implants, they still have silicone in their body.
They have a solid silicone shell. I removed a pair of implants once that was 45 years old. She had them done in the 70s when they first started, and no one ever told her she had to swap them out because no one knew. They were just putting them in.
Were they like rocks?
And there was no shell left at all.
Wait, what
So
shell?
the shell of the implant was completely gone. So
It was being held in by the capsule?
yes. So this is
her body like ate the silicone?
Yes. So this is what I've learned from taking them out at so many different time periods. The longer the implant's been in, the more slimy the shell feels. If it's relatively new,
So it's
it
breaking
doesn't
down.
feel shiny.
Right.
It doesn't feel slimy. The older it is, the more slimy it feels. And I always imagined when I first started in practice that when an implant ruptures, it's like one specific spot that just rips, right?
But it might be just
I don't
wearing
think
away.
that's what I've figured out.
Yeah.
That the shell just gets worn down. And it's not going to wear down evenly as a whole. Some spots are going to wear down faster than others and things like that. And eventually a spot gets weak enough and then something pushes on it,
It's like
and
a
then that's where it
spot.
ruptures, right?
Wow.
And that to me is another reason to swap them out on time.
Yeah.
Because you
don't
don't
want
want
that
you don't want this broken down shell that may seem intact. It's gonna have some leak.
Yeah,
Switching
how
them
often?
out,
10 years?
I recommend like 10 to 12 years. Switching them out when you don't have a problem.
Is better.
It's
than-
hard to rationalize to yourself because you're having a surgery when nothing's wrong.
Right.
But it's so much easier, less expensive,
And
less
painful.
complicated.
Yeah.
It's so much simpler than waiting till you have to. There's maintenance. It's
Yeah.
not a lifetime device.
So if you get them done at like 20,
you're gonna do them a few times, yeah.
that's like $70,000-$80,000, right?
Depends where you go.
The prices are probably going to go down over time.
No.
Another thing that I learned from watching people like in their own experiences, like a lot of people didn't like drains.
Yeah.
So I remember I was like, am I going to have drains? And you were like, yeah. And I was like, oh, shoot.
Uh-huh.
But then I realized like it's so much better for your body to let all of that liquid leave your body instead of it being
Yeah.
trapped in there.
So drains. I love drains.
Yeah.
Most surgeons hate drains.
Uh,
Surgeons hate drains because patients hate drains. However, the vast majority of surgeons use something that's called a flat JP drain.
okay.
So the part that's inside the body is this flat, smushy, white kind of tube. The part that comes out is a round, firm tube that can't be compressed. The flat part inside that's smushy, you can imagine when it's in all this tissue swished around it, it's just going to get compressed and now
Yeah.
it can't work. So if the drain doesn't work, it's
What's
going to
the
be
point?
uncomfortable
Yeah.
and it's going to be in a lot longer. It's going to irritate the skin longer. And then when it gets removed, now you have to like pull that out like aggressively.
Mm.
And it's very uncomfortable. So patients get very upset with the drains. They're uncomfortable. They're not working. They have to see the doctor again. So there's been a very big movement lately
Against.
to not use drains in almost
Right.
anything. And I don't think that's great because there are a lot of surgeries that produce a lot of fluid. There's a lot of inflammation. You take out a capsule, in most people, that's a lot of empty space that has to stick down. And when body sees empty space, it fills it with fluid.
Mm.
And you get a whole bunch of fluid in there. Some of it your body can absorb, some you can't. If you get enough fluid and it doesn't get absorbed, you won't even know you have a problem for a few weeks. You're going to think you're recovered, and the next thing you know, that
The
pocket
fluid.
of fluid, which has bacteria and all kinds of food for bacteria and a little bit of blood and lots of fluid, it can get infected, and it can make its own capsule, believe it or not. And then
Wow.
and then you'd have to go in and take the capsule out to get rid of it.
Oh.
So, but even if it doesn't, you can have this pocket of fluid, it can get infected, you can end up having to drain it, having to be on antibiotics, all this stuff. So from my perspective, I don't put drains in every surgery, but I think there are a lot of surgeries that need it. And there are times I'm in the OR and I thought maybe I'd use one and I look at it and go, this isn't that inflamed. It's going to be fine. I don't put one in. I mean, I think it depends on the situation. But most times you take out an implant, you take out a capsule, you're moving stuff around, you have a lot of empty space, you have a lot of inflammation, you put the drain in. They make a drain that's round all the way through and is not compressible and has long channels. So it doesn't matter if part of it's squished, the rest of it's going to work. And it just lets everything out
Yeah.
and it pulls out with no problem.
Oh my gosh, I didn't believe that it.
No one ever believes me.
I really
I'm like,
didn't.
this won't be horrible. They're like, you're lying.
And I thought like I thought best case scenario it'll hurt, but it won't be like excruciating
No.
to people. I didn't even feel it. I don't know how it's possible. I didn't feel it like moving. Like it's so weird.
It's, you know what makes me crazy? Those drains are available everywhere. They
So it's
have
not like
them.
a special thing.
No, they have them
Right.
in all the hospitals. You can order them from the same place you order the flat ones. They cost the same.
Oh my
And
gosh.
I just don't. I just don't. I think people are just so used to the flat ones. They use them in everything. They use the flat ones in general surgery, orthopedic surgery. Everyone's using them.
Okay.
And these round ones, they have them everywhere,
Mhm.
everywhere, and it makes such a difference. I mean, your veins were not in very long.
No.
Like, I don't have
You
anyone who
changed
keeps
it
them
for me.
forever.
I was like, I'm not gonna be able to do it.
I was gonna say, I wanted you to like tell the people like what was the experience really like
Recovering?
with the drains.
Honestly, I thought it was going to be worse than it was. Like the bra that you put me in, it had a little like holder for the
That's a
drain.
big deal too. Because
Yeah.
otherwise, there people are safety pinning it to their clothes and
Yeah.
they're getting stuck.
I was
Yeah,
like,
that bra's great.
yeah, because like you're on like drugs and stuff, and I was like, oh, I was worried about being paranoid that they would like fall out. Cause,
Yeah.
like, I don't know if the thing is here or if it's all the way around.
It's inside. It's stitched to the outside, but the stitch can get loose. That does
Right.
happen once in a while.
Right.
So yes, you're not wrong. It needs to be supported.
Yeah, and in your mind, you're like, I don't know if this tube is like here or if it's like,
It's usually
It's-
yes
right,
inside.
which-
It's
yeah.
a good amount.
yeah. So like
Yeah.
you're like, oh my gosh, if I stand up and like it swings, it's gonna just fall out. You know, you get scared. But because it was hooked up to the bra,
Yeah.
I wasn't even thinking about it.
Seeing how much came out, wouldn't you
Yeah, I didn't
rather
even-
have that
Right.
out, and
Right.
then you can see it slowing down,
Yeah.
and you know
Oh, I'm
things are
healing.
healing.
Right.
Exactly. Things are healing. Everything's sticking together because it wouldn't be slowing down this much unless everything was gelling. Ooh,
What was
you
that?
lost your.
Oh, the mic.
fell.
Can I talk? Or should I wait a second?
You should wait a second.
Okay.
I can't stand, by the way, how cute you two are. It's like
Aw,
unbearable.
thank you.
Oh my god. I'm still like that with my husband, and every once in a while I see people looking at me like, we've been together over 15 years,
Aww.
and we still
How'd you guys
have
meet?
that. Playing pool in a bar.
Oh, that's cute. In
What
the
are you gonna
city?
do? Yes.
It was so nice getting to know each other as people and not just, oh, this is my doctor and this is a patient. We really enjoyed laughing and just getting to know each other.
I do really appreciate you taking the time. I know you're very busy. I think it's something that really needs to be out there, you know, and I'm glad that we could both do it together.
I'm glad to. I think it's important to also kind of take a step back and know that the vast majority of women who get cosmetic breast surgery are thrilled. They're super happy, it's life-changing, it does wonderful things, but you're going to be happiest when you go in with like your eyes wide open
right.
and the right information. There's a lot of different ways it can be done and they can turn out differently.
Right.
So that's what you should keep in mind. And when you
Right.
do them well, for the most part, it's going to be great.
Do you have any social media that we can tell them to follow? You're like, ah.
So I'm going to have to do it. My
Yeah.
website is very good.
Thank you for your time. I hope
Thank
you guys enjoyed it. See you in the next one. Bye.